Ashley, when it does hurt and you come back and I take an x-ray, I may have to send you down the hill to the endodontist because the condition has worsened to the point where I don't think it's salvageable. As long as you don't mind taking a trip down the hill to get it taken care of, take your chances, just come back when it hurts. But accept the fact that when it does hurt and I can't treat it, I have to send you down the hill.
Right.
I've informed you of everything that I saw and what I think is going to happen. It's your decision at that point to decide whether you want to act or not to act. Okay? Now, I'm going to play the devil's advocate here. I'm looking at this tooth. Do you see a line down here? Do you see this? Do you see something here?
Faintly.
Faintly. Do you think I'm going to spend 45 minutes on this tooth? No.
No.
I probably can't find these canals. And yet the patient's in pain. What's my choice? Well, Chelsea, you can save this tooth, but I have to send you down to the endodontist. Next thing they ask you is, oh, that's a specialist. How much that's going to be? Probably about $1,500 to save that tooth. And then I have to pay for the crown, and then I have to pay for the build-up. And then even at that point, you're going to tell me that it's 25% chance of failing. I think I'll take that out of the tooth.
Mm-hmm.
So that's a conversation you don't want to have with a patient that's been with you for 20 years. Dr. Nguyen, didn't you see this when you first saw me the first day? Or every 6 months that you saw me for extra, didn't you see this? Okay. So there is a choice here. You can wait for treatment as long as you're willing to pay for it or accept the consequences of waiting. You can do it. Remember, there's no emergency unless you're in pain or I see an abscess on your x-ray. Right? Pain, obviously, we need to take care of it so you're comfortable. Abscess, we need to take care of it so it doesn't affect any other parts of your body that is medically compromised. Okay? So, do you see a line here? No. This is underneath the crown. Chances are I'm going to send these teeth out because I don't have a huge microscope that can help me find these little parts. The last tooth that we sent out, the patient came back with a note from the endodontist. Dr. Nguyen, I'm sorry we were unable to go any further than you went. I was able to come down halfway here, and the endodontist couldn't go any further. And they said, proceed with caution. So I told the patient, we're not putting a crown on this tooth. We're going to wait. Give me 6 months. If the tooth is fine, we'll put a crown on it. If not, we're not going to plan on spending that money and time on a tooth that's going to fail. Okay? So here's an abscess right here. You can see the difference in color here. Okay? Here's a huge abscess in the front here. Here's a huge abscess here. You notice it's blocked off here. Here it's blocked off here. Up here, it's blocked off right here, but this part's open down here. That means, just because it's blocked off doesn't mean that there's not a crevice there, that bacteria can't go down. Remember, that nerve is closing, 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 and right before it completely closes, it dies. So it leaves a crevice about that small in your tooth. Something that should have been this big is now that small, and our instruments can't get down there. Okay. The whole purpose of a root canal is to clean out all of the bacteria in this area and fill it up. It's like taking cement and pouring it down your kitchen sink. You'll never use that sink again because nothing can get down there. Okay. Nothing can go up, nothing can go down. Here we go. We have another abscess here, another abscess here. This was caught on time. Okay. So there's 2 stages for teeth that are dying. You're either infected or you're not infected. If you're infected, you have pain, swelling, and or radiographic abscess, sign of an abscess. If you're affected, there's no pain, no swelling, no radiographic evidence of an abscess because it hasn't progressed to that point. But you can see that the nerve is dying. Okay? This generally happens underneath old fillings. This generally happens underneath fillings that have been leaking been broken down over years and years of use. Why? Because the old fillings are already, your initial cavity that you had was already deep, close to the nerve already. And then as years go on, bacteria, saliva, food gets down here, and the process of decay starts all over again, this time much closer to the nerve. Okay. When you have that, then you start to see the nerve starts to die. And you'll see the blunting of some nerves. Okay. You'll see that this side right here, let's say the cavity is right here, you'll see this side here is, you can see the space, but this side over here is either completely blocked out or filled in with cloudy things on the x-rays. Because on this side, it's far enough from the decay that it's starting to close. It can react to the bacteria coming in. This side, it just died completely. Mm. So this past week we had a gentleman, someone come in, or it was, Mrs. Pickett's daughter. She had that crazy number 2 tooth, and I opened it up. 2 of the nerves were dead. One nerve was still alive, and that was the nerve that was causing her the pain. So 2/3 of her nerve has died already, and she didn't even know. The third one was about to die, and that's how she knew. So pain is very subjective. It's based on the individual, and it doesn't do well to predict dental health. Once you have pain or broken teeth, it's too late in most cases. So we want to avoid that. We want to look at an x-ray and say, that tooth is dying. You either wait until it has pain, or you can come in and take care of it before it has pain. Those are your options. Is that 10 minutes?
7.
Okay. Any questions about dentistry?